Thank you for the introduction. For our webinar today, I will be going over how we're setting a new standard by enabling next-day comprehensive genomic profiling with the Ion Torrent Oncomine Comprehensive Assay Plus on the Genexus system. Before I go into the assay, a brief background on the need for comprehensive genomic profiling. Advances in precision medicine means more and more relevant biomarkers are emerging across different cancer types. This includes targets relevant to targeted therapies and immunotherapies, as well as basic molecular classification of tumors. Current guidelines recommend multi-gene NGS assays to evaluate multiple biomarkers simultaneously. CGP enables the simultaneous analysis of a broad range of biomarkers into a single test. As we gain a deeper understanding of the molecular mechanisms of tumor biology, CGP is critical to drive insights into advancing the future of personalized medicine. There are many advantages of bringing comprehensive genomic profiling in-house, but most importantly, it's reducing the turnaround time from weeks to days. This is because even if you can get results, if it comes too late, it will not be informative. Also, in-house CGP enables more control over the tissue logistics and pre-analytical parameters while building expertise internally to help foster more collaboration. To enable bringing CGP in-house, I'd like to introduce the Oncomine Comprehensive Assay Plus. This assay was first made available on our GeneStudio platform, but is now also available on our Genexus system. The assay is the same across the two platforms and is enabled by Ion Torrent technology. It uses an amplicon-based approach to detect a broad range of genomic alterations from 517 genes, including single nucleotide variants, insertions and deletions, copy number variants, and fusions, including gene translocations and splice variants. Additionally, the assay detects genomic signature-based biomarkers such as HRD, TMB, and MSI. This CGP assay facilitates the simultaneous analysis of a broad range of biomarkers in one test to maximize insights into the underlying oncogenic drivers in a timely manner. I want to highlight a multi-center study that assessed OCA plus performance broadly. To bring CGP in-house, it is important for an assay to be easy to implement with good technical performance. We initiated the study several years ago with the goal to demonstrate this. This study was done across 5 laboratories in Europe on a highly heterogeneous cohort of FFPE samples comprising of diverse tumor types with variable tumor content, including samples with only 10% tumor content. This study demonstrated a high overall sequencing success rate of 94% on this diverse cohort. In addition to being able to demonstrate sequencing success with clinical research samples, the 5 laboratories looked into accuracy of the assay by measuring concordance to reference standards. This included assessment of performance of SNVs, indels, copy number gains, copy number loss, and fusions. They also evaluated HRD, TMB, and MSI. In all, over 400 variants was analyzed across these sites, and they demonstrated a greater than 95% concordance to orthogonal methods. In conclusion, the Oncomine Comprehensive Assay Plus demonstrated high analytical performance as a sensitive and specific assay for comprehensive genomic profiling. This full study has now been published in the Journal of Molecular Diagnosis and Therapy, led by lead author Dr. Eloisa Yantus-Leventre. As shown in the previous slide, the study looked into HRD concordance. I want to provide a brief background on our approach to HRD. To properly measure HRD, we want to evaluate both causes and consequences. In ovarian cancer, we look into pathogenic alterations in BRCA1 and BRCA2 as the causes of HRD. And for consequences, we measure the genomic instability metric, or GIM, with OCA+. GIM is a novel metric that quantifies genomic scarring using genomic segmentation to summarize unbalanced copy number changes in autosome. This is a numerical value between 0 to 100, and for ovarian cancer, a GIM score above a threshold, which is 16 for the GeneStudio platform, is considered positive for genomic instability. For HRD assessment, having either a known cause or consequence is sufficient for a sample to be considered HRD positive or deficient. Only when there are no BRCA variants and a low GIM score is the sample considered HRD negative or proficient. Here's a summary of the HRD studies that our customers have completed using OCA Plus on the Gene Studio. All of these studies looked into concordance of OCA Plus compared to a reference standard. There's the prior multi-center study that I described, in which 18 samples was used to demonstrate HRD concordance. In addition to the prior study, we also have a study done by Dr. Annette Stabler in the University Hospital Tübingen, who looked into a cohort of 54 ovarian cancer research samples. Dr. Nicola Normano, who will be our next speaker, also completed a study on 100 ovarian cancer samples. And we'll go into more details of the study and the data in the next part of the webinar. In all, these studies demonstrated good overall agreement of OCA Plus compared to the reference standard. With the prior customer-led studies that demonstrated good analytical performance of OCA Plus for HRD status, we're continuing to expand our studies with a very important sample cohort to look beyond analytical performance. This collaborative study is being done with samples from the PAOLA-1 clinical trial, which will be a different cohort than the MITO-MINGO study that Dr. Normano will describe next. For those not familiar, the PAOLA-1 trial was a phase 3 trial evaluating Lynparza, which is a PARP inhibitor that is of interest for HRD studies, combined with bevacizumab versus an active comparator, which is a bevacizumab plus placebo in advanced ovarian cancer. In this study, we are looking at the agreement of OCA Plus with the reference method. This includes comparing the mutational status of BRCA1 and BRCA2, as well as genomic instability and overall HRD status. The data demonstrate that we had a 91.2 overall percentage agreement with the reference method, consistent with prior analytical studies. We also did a retrospective study on progression-free survival to determine future clinical relevance. The data shows an improved hazard ratio for HRD positive cases with a hazard ratio of 0.37 compared to HRD negative cases with a hazard ratio of 0.91. This is a very exciting data set that was initially presented at ASCO earlier this year. We look forward to completing the study and publishing the results. Please note that OCA Plus is a research use only assay, and we look forward to these future clinical research studies. Now let's switch gears a little bit and let me introduce the Torrent Genexus platform. We launched this system several years ago with a 2-instrument NGS sequencing platform that automates the main steps of the NGS workflow. With just 2 touch points, one for setting up the automated sample purification run on the Genexus purification system, and the other for setting up automated library preparation, sequencing, analysis, and reporting on the Genexus integrated sequencer, we bring speed and simplicity to NGS. This allows us to offer next-day NGS results with just a total of 20 minutes of hands-on time. By combining the benefits of the Genexus system with the broad coverage of Oncomine Comprehensive Assay Plus, we're now able to offer next-day CGP. This all-in-one solution that is complete, easy, fast, and robust. Complete meaning one vendor, end-to-end from sample to report, to really simplify implementation into your lab. Easy meaning with minimal touch points, this reduces handling errors, frees up time, and reduces labor costs. It's fast, and fast as in not in like a 4 to 5 day turnaround time, but next day results for important insights in a timely manner. Robust because the assay is based on AmpliSeq technology demonstrated with high sequencing success, which means more samples can be tested with informative results. Next day CGP is here, and we've integrated the speed of simplicity of OCA Plus on the Genexus system. Since OCA Plus detects a broad range of genomic alteration, we put together some of our internal R&D data to summarize its performance on the Genexus platform. Here we demonstrate the performance of each individual alteration type, the SNVs, indels, CNVs, including gains and losses, and fusions. As you can see, using a combination of reference controls and FFPE samples, the assay has high sensitivity and specificity. Moving away from the basic genomic alterations, I want to cover each of the genomic signature-based complex biomarkers. First, looking at tumor mutational burden, or TMB. Accurate assessment of TMB is important because research has shown that TMB may correlate with response to immune checkpoint inhibitors. OCA Plus evaluates TMB with more than 1 megabase of exonic coverage. Here, we compare the TMB values across reference cell lines that was used in the Friends of Cancer TMB harmonization study. Orthogonal assays include whole exome sequencing, an in-house CGP vendor, as well as a send-out CGP vendor. As you can see, TMB by OCA Plus on Genexus is highly comparable to these different assays. Next, we're looking at microsatellite instability, or MSI. OCA Plus determines MSI status by assessing 76 microsatellite markers to generate a numerical score. Scores greater than or equal to 16 are considered MSI high, and MSI scores of less than 15 is considered a microsatellite stable, or MSS. As you can see here, MSI performance with the OCA Plus on Genexus assay is highly sensitive and specific across different cancer types when compared to PCR-based reference method. Now let's take a look at our last numerical genomic signature, GIM. As a reminder, GIM is a novel metric that quantifies genomic scarring. The method of GIM quantification is the same on our GeneStudio and Genexus systems, but the thresholds was determined for optimal sensitivity and specificity for each system separately. Despite the different thresholds, the overall percent agreement of GIM status between the two systems is high in ovarian cancer research samples. GIM can be used to accurately determine genomic instability, whether the samples was run on the Genexus system or the GeneStudio S5 system. This is a very exciting new biomarker for which our next speaker will present in more detail based on his early access experience. Now, I also want to summarize the broad range of relevant variants that has been detected by OCA Plus on Genexus across different tumor types by our R&D team. From ALK fusions, EGFR T790M, and L858R mutations, to MET exon skipping in lung cancer, also BRAF V600E, KRAS G12D, PTEN copy loss, and microsatellite instability in different gastrointestinal cancers, or ERB2 copy number gain and PIK3CA in breast and ovarian cancers, and even MTAP copy number loss and 1p19q co-deletions in glioblastoma. Together, the ability of OCA Plus to detect relevant variants with high analytical performance makes it very suitable for comprehensive genomic profiling for solid tumors. In addition to GIM for HRD, the assay's genomic segmentation algorithm allows us to evaluate novel endpoints. The segment information can be used for arm and chromosome level copy number events. In the visualization here, you can see a co-occurring copy number change across different chromosome arms. This is a 1p19q co-deletion in an oligodendroglioma sample. Thank you for allowing me to present this new and exciting offering of OCA Plus on the Genexus system. In summary, OCA Plus is a complete end-to-end solution offering next-day CGP results. It is easy with a highly automated workflow that requires only 20 minutes of hands-on time. It is fast with next-day CGP results for timely insights when they are needed. And it is robust with a very high sequencing success rate based on AmpliSeq technology with low sample input requirements. Next-day CGP is now here, and Thermo Fisher Scientific now simplifies bringing in-house CGP to a laboratory to make NGS more accessible. I'm going to turn it over back to Dr. Normano so he can tell you a little bit more about his experience with this assay. Thank you for your time.